थैंक यू डॉक्टर जुनैद सर, आपने बहुत अच्छे से बताया और काफी अच्छा उसका रिस्पांस आया एंड वी आर ऑल हैप्पी। और विल डेफिनेटली जो आपका ये मुहिम है इसको और आगे कहाँ तक ले जा सकते हैं उसके लिए पूरी कोशिश करेंगे। तो नाउ कमिंग टू द नेक्स्ट speaker, he's from Malaysia. I'm really sorry, Dr. Vishudhi.lee. We are little going ahead of time, but we'll definitely like to listen you. And unka, just provide his introduction. I will request Mr. M.V. Ravindra to kindly introduce Dr. Vishudhi.lee.
Yeah, I thank Dr. Antim Kumar Jain ji for giving me this privilege of introducing a legendary figure in the field of Master Tung and Chinese acupressure, Dr. Vishudhi.lee. As his name suggests, Lee is a Chinese name, Vishuddhi is an Indian name. He is popularly known not only in Malaysia, even in Thailand, China, and Southeast Asian countries, because he's really a legendary figure. And he's a practicing acupressurist, acupuncturist, and homeopathy therapist from Malaysia. And he is, he has studied in China also on International Acupuncture Training Center, and he is a disciple of another legendary figure, Dr. Lee Ko-cheng, a very prominent direct lineage teacher of Master Tung acupuncture in Taiwan. So he has got links with Taiwan, Malaysia, India, and also in China. In the field of homeopathy, he is a postgraduate from the National Academy of Homeopathy, Nagpur, India. That's how he has got an Indian link. He holds Diploma in Acupuncture from Medicina Alternativa, Open University, and in Homeopathy from the Homeopathic Academic Council of Malaysia. He holds practicing certificate from the Malaysian Ministry of Health, that is equivalent to our registered medical practitioners in India, like that. It is the Ministry of Health, Holistic Healthcare Practitioner Society of Malaysia has given him certificate to practice, and Malaysian Society for Complementary Medicine, is a member. And then Master Dr. Lee also teaches the Master Tung style and balance method of acupuncture system. See, Master Tung system is very popular nowadays, picking up very well throughout globally, especially in Southeast Asian countries. And the person responsible is none other than Dr. Vishudhi.lee. His other areas of expertise is, holographic gua sha and Chinese bloodletting. He's an expert on that. More than anything else, another greatest thing what he has contributed to the field of medicine is, he has developed a Acupedia, an app, a groundbreaking medical software program which integrates classical and modern acupuncture practices into a single module. It's a great achievement which is useful for all the therapists. And I once again extend a hearty welcome to him and hand over the session to him for his discourse. Thank you, sir. Most welcome.
Thank you, Mr. Ravindra. Thank you very much for introducing Dr. Vishudhi.lee. Dr. Vishudhi.lee, as you told, he's a true healer. See, if you are a healer, no boundaries can restrict you. If you are a doctor, then definitely there are boundaries. And after Dr. Vishudhi.lee's lecture, we'll once again have the talk in Hindi with Dr. Rumi Ramji. So kindly stay tuned. And now I hand over to you, sir, Dr. Vishudhi.lee. Thank you.
Okay, hello everybody. Many thanks for this opportunity to talk about Tung and balance. Thank you to organizers and participants. Thank you to participants who have stayed on. All right, and also to all my friends. I see many of my friends here, and just want to say I miss all of you. The good news for me is that I'll be able to come to India very soon. So I'm Dr. Lee, talking from Malaysia, and I'm going to share my screen. Most of my discussion will be from my screen. And although we seem to talk about certain principles which may differ from what you have been taught, but believe me that it still comes under classical Chinese medicine. All right, there's a big debate going on between what is classical and what is traditional. I normally do not like to get into all of that, but if I do say certain principles which appears very different, I hope you will stay tolerant and patient. Let me try to share my screen. So today's talk will be on Tung and the balance method. Tung acupuncture was a family tradition acupuncture, not meant to be taught outside the Tung family. But Master Tung Ching Chang decided to take students in 1962 because none of his children wanted to continue the Tung tradition. So many thanks to his children for not wanting to learn acupuncture. We are now able to learn his secret family tradition. Dr. Tan, Richard Tan, also from Taiwan. By the way, Master Tung was born in China but practiced in Taiwan. All right. Dr. Richard Tan, who is credited with the balance method, is born in Taiwan. Right. And hooray for engineers, because the background of Dr. Richard Tan is an engineer. Okay, so I am an engineer too. So for all the engineers who are out there who are healers, take it from me, we make good healers. So Dr. Tan, although an engineer, but he dedicated his life to study Chinese medicine and develop a system whereby he could get results instantaneously during treatment. All right, we would discuss more of that as we go on. So let's start with what is Tung acupuncture. All right, this is the 14-channel system. Most of us, or all of us, are taught this 14-channel plus all the extra vessels. So we call this the 14-channel acupuncture system. They are made up of channels numbering 1 onwards with the pertaining organ. This is the Tung system. As you can see, there are many body points. The 14-channel system is reputed to have more than 300 points. Some say it's 700 points, but let us say that it is 300 points or 365 points. The Tung system also have similar number of points, also about 360 translated points. Okay, another 300 points not translated yet to the English language. And how the points are numbered, they follow zones. All the points on the finger starts with 1, 1. At the hand starts at 2, 2. Forearm, 3, 3, 4, 4, and so on. This different numbering system has made the TCM practitioners, kind of unfamiliar with Tung because of different numbering system. But believe me, the principles between the two systems are the same. They are basically based on junk food theory and the channel relationships. Large intestine channel. So I'm going to demonstrate the difference. Large intestine channel. So all of us are familiar with the part of the large intestine channel. L1 at the finger, 2, 3, and so on and so on. Now have a look at where the tongue points are located and how they are numbered. 33, 0, 1, 2, 3. Why 33? Because it's on the forearm. Okay. So Master Tung has very cleverly, in fact, his family has very cleverly found additional therapeutic points on the channels. And you can see the points. So 3301, 0203, because they lie on the large intestine channel, they also share the properties of all the points on the large intestine channel. But what is very exciting and useful for us is the Master Tung family has found new therapeutics, new indications. For example, here 3301, 0203, they have found that it has a uplifting, like an astringent reaction to the body. It uplifts tissues. So they have found that it's useful for prolapse. Also, commonly listed in the books, useful for hemorrhoids. Small intestine channel. All right, I just take a few examples to give you a feel of how Tung system works. Small intestine channel. All right, although different channel, but again, Tung here is listed as 33 because it's on the forearm again. All right, so 33, 10, 11, 12. All of this on the small intestine channel. And as in most points in small intestine channel, it can treat neck disorders, ear disorders, all right, trigeminal neuralgia. But Tung system has put in extra exciting indications on these points. 3310 is inflammation of intestines. 3311, acute hepatitis, among other indications. And 3312 helps the heart function. And coincidentally, 3312 is the favorite point for knee pain among Tung practitioners. In the Tung system, although I don't really understand in full yet, any points which treat the heart will help the kidney. It is said that when you improve blood circulation, the kidney, which is the joint which requires a lot of blood, will benefit when blood circulation improves. Spleen Meridian. I hope everybody is following. Spleen Meridian. There are so many additional points on the Spleen Meridian. Why it starts with 77? Because 77 is on the leg. 77, 17 is the same point as spleen 9. 77, 21 is spleen 6. Many Tung points are on the same location as the 14 channel points. They share the same indication, of course. But Tung has got new indication, extra indications, which practitioners have found them useful. For example, 7718 is the top Tung point to treat kidney disorders. So generally, this set of lines, this set of points, 17, 18, 19, 20, 21, is listed as a kidney activation line. And that's where we start to get confused and we will trouble our mind to debate why should a spleen channel, treat kidney. But when you study classical acupuncture and the channel relationship, you will find that it's true. The spleen channel can treat kidney disorders. All right. Now, 7718 is, apart from kidney disorder, is also the favorite point among Tung practitioners to treat frozen shoulder. Very much like in the 14 channel system, the use of stomach 38. All right, this is stomach 7718. So what happens in the clinic, a typical clinic for like me? All right, I will use stomach 38, activate. If I don't get improvement, I then switch to some 7718. So a Tung system allows us that extra tool, but I'll get on to how to combine these two systems later on. Okay. Don't mess it up. I can't scroll now. Okay. Okay, I'm back. Now, have you ever wondered why there are no points or no channel between the middle finger and the fourth finger? I think in the Sujok system, they have points, but in the 14 channel, we don't have points. Why not? All right. And the Tung family has so kindly found good points, useful points for us. And in this case, Ni Bai and Wai Bai are two extra points. And the points are not on any channel because the Tung system are not restricted by channel only. And this was taught to me when I was in Taiwan. The indications are allergies, blood, spleen, pancreas, immunity issues. And the teacher told me strange diseases. So I asked the teacher, what is strange diseases? He said diseases which you cannot diagnose, he says. You're not sure what it is. Okay, so he called it strange disease. But I think it's related to autoimmune disease. Right? I've not actively used this point, but if I have to, I will use it. All right, because there are points on safe locations. Let's quickly look at the protocols. Protocol. How does a 14 channel protocol look like, and how does a Tung protocol look like? All right. So knee pain treatment on the left is familiar. Acupuncturists are familiar with this sort of treatment. All right. I'm not saying every one of us use this, but it's quite typical. If you walk into a clinic and you have knee pain, these are the points they use, and they will probably use electrical stimulation. On the right side is the Tung system. Put 2 points on the finger. So starts with 11, 11. I don't have the time to discuss about why is there, but that is how a Tung clinic will look like. All right, and don't be surprised. And we always treat contralateral, which means if the knee pain is on the right, we will use the fingers on the left. Sciatica, all right. On the left, typical TCM protocol, and on the right, again, we will use the hand. All right. 2205 is just like stomach 36 is kind of top point for the 14 channel system. 2205 is the top point for the Tung system. It moves blood generally all over the body. Now, as I go on, I'm also going to discuss the underlying principles because I don't have the time to talk about it separately. So now I'm going to talk a bit on imaging, why the hand can treat the low back pain or the sacrum or sciatica because of imaging. All right. In classical Chinese medicine, we have this holographic correspondence. So in this case, all points on this dorsal hand can be used to treat issues concerning the sacrum. All right. Of course, you palpate before you put the needle, all right? But that is under the methodology of Tung. Treatment for migraine. Okay. Now, 6605 is stomach 43. It has the same indications, but it is useful for me too that 6605 can treat all kinds of headache. This is not the only point to treat headache under the Tung system. There are maybe 30, 40 points to treat headache. Same as in the 14-channel system, we have to do our diagnosis. We have to do channel diagnosis. We have to do organ diagnosis and so on. Eye disorders, all right? Glaucoma, short-sighted, long-sighted, all right? 5502 is known to be effective for eye disorders. If you notice, 5502 is on the opposite side of the liver channel. Liver is on this side, 5502 is on the underside. And according to Tung, you can trigger the liver from the underside. And when you trigger from the underside, is effective for eye disorders. Right? And in classical Chinese medicine, the liver is related to the eye. So actually, it makes sense. It's not a random indication. Neck pain. 14-channel system also treat distally. Distally means we do not put 14-channel system. SI3 is commonly used for neck disorders in the TCM system. Of course, in the Tung system, we also use SI3, but we use the Achilles tendon. Achilles tendon. We use the bladder meridian right there. All right, it looks painful, but it's not. All right. So I think I'll be running out of time. All right. So to summarize, the Tung system do not needle pain areas. The Tung system likes to needle 3 needles in a row. It's a very forgiving system. Unlike the 14-channel, you have to learn point location very well. In the Tung system, you have to know your channel. As long as 2 or 3 needles or even 4 needles is on the correct channel, you will get the curative effect. Pain, you treat opposite side. Organ issues, you treat bilaterally. All right. And there's a method called motion acupuncture, which means when you put in the needles for pain, example, ankle pain, you put the needles at the wrist, you must make the patient move. And this is called motion acupuncture. It's very like stomach 38 in the 14-channel system. When you treat stomach 38, when you treat stomach 38, the patient must move the shoulder. If the patient do not move the shoulder, stomach 38 will not be effective. All right, but only a few points in the 14-channel have this characteristic. But in Tung system, most of the points have this characteristic of motion acupuncture. It is only powerful if the pain area is moved or massaged. So you have 14-channel and you have Tung. Which system do you use? All right, now, which system do you use? Is Tung system better than 14-channel? No, it's not. Is the 14-channel better than the Tung system? No, it's not. Is karate better than judo? No, it's not. All right, but a practitioner who is skilled in both 14-channel and Tung system is a more able practitioner. So my advice is we would benefit if we learn both the systems and even other systems which we find useful. So to the answer, we must stop the debate of Tung is better or 14 channel is better, and one treats the root, one treats the branch, and so on. So it's a waste of time to discuss which is better. Sometimes I use both in one sitting. Sometimes I use Tung on Monday, 14 channel on Tuesday. All I want is the patient gets better. And of course, you know, the patient couldn't be bothered which system you use. Another reason to learn Tung is the Tung system believes that bloodletting is superb. Bloodletting solves blood stasis issue. If you have a blood stasis issue, nothing from my point of view, nothing, is super effective when you bleed. And it is a method which you need to learn. All right. And when a patient comes in, headache, migraine, tinnitus, anything connected to the head, and I think that there is a blood circulation problem in the head, I will bleed the ear. And the patient will say, wow, everything is so bright now. All right. I have to rush, I know. Tung bloodletting has some special characteristics whereby if you have issue with the mouth and teeth, you will go to certain parts of the body, and you can see it from the slide. You will go to that part of the knee, and you will check if there is some discoloration there. If there's some discoloration or some capillaries, you then bleed that area. And if there are issues with the ears, you check. These are the areas to check on the leg if you have organ issues, heart, stomach, liver, kidney. So there are certain areas mapped out by Master Tung that you examine. And if you find those areas suitable for bleeding, then you bleed. All right. So this is quite special that Tung has this in the bleeding system. All right. This palm diagnosis chart used by Master Tung was supposed to be a secret, all right? But I think over the last 20 years, they released this chart and it's now freely available, whereby Master Tung used the palm to diagnose, which means he looks at the palm and he checks whether there are discoloration or a rash or a mole, or it is soft and it's too hard, and a bit like we use pulse diagnosis, he uses palm diagnosis. Underlying principles. Okay, balancing the channel. Balancing the channels is using one channel to treat another channel. Nothing new actually, but lung is used to treat spleen. Why? Because it comes on the same name, tie-in. Both are tie-in. One is hand tie-in, one is foot tie-in. And they found, and Dr. Tan found, not that he discovered, but he very cleverly put it in a nice chart for us. All right. If you have a lung issue, go to the spleen. If your spleen channel issue, go to the lung. All right. If you have large intestine issue, go to the stomach. All right. Why? Because same name. Yan Ming, Yan Ming. The other relationship is the husband-wife relationship. When you have a lung issue, you go to large intestine. This is taught in 14-channel system. But mainly they only taught the husband and wife relationship. In the balance method, there are 6 relationships. All right. So this is a bit on the balance method. Imaging system, coming to imaging. Look at this image. All right. This is called same height imaging system. The elbow, right elbow can treat the left elbow. Lung 5 can treat LI 11 because it's at the same level. How we do it, there's a little bit of method to it, but this is the philosophy, this is the theory of holography. All right, one part of the body can treat another part of the body. If you find it difficult to believe, then how do we believe oracular acupuncture, that every part of the body is sitting on the ear? So it's not difficult to believe that the left elbow can treat the right elbow. You try it. Every time a patient comes with a right elbow pain, you check his left elbow. You palpate his left elbow and you will find a painful spot. And he will tell you, how you know? all right, and you will appear intelligent. All right. Okay. There are many imaging system, or many imaging system. This imaging system is the wrist. The wrist treats the ankle. Okay, this is a bit of a tongue show off sometimes. If you have an ankle pain walking into your clinic, there is a point here when you on the wrist you put, and the ankle pain will be relieved, provided it is not fractured, things like that. All right, and in my experience, 10 ankle pain, this point works maybe 6 times, 6 of the 10, which is very good. Okay, and elbow treats the knee. Li 11 is a common point to treat the knee in the tongue system. Okay, so there are more, the wrist also treats the neck. So it's not only wrist treating ankle, wrist also treats the neck. Okay, looking ahead, since this is a conference about latest techniques, looking ahead, we have to talk about fascia. All right, fascia is the latest development now in the acupuncture world in trying to understand meridians and try to understand why tongue points works. And it will be very good if we join in this debate as to the role of fascia. Fascia is the connective tissue around our muscle and around our joint. All right, and it is said whenever we have muscle pain, is it actually the muscle pain or the fascia pain? Okay, there's some food for thought for all of us here. All right, when we put in the needle, we always say the muscle is gripping the needle. All right, the muscle is gripping the needle. The host has spotlight. The muscle is gripping our needle. That is why we get a dirty. But the latest development indicates there is the fascia that is gripping the needle. Interesting. And they have found that this interconnecting tissues is from top to bottom, right to left in the arm. And here I show you some of the lines. And the superficial, I want to talk a bit about the superficial back line. I'm going to finish the superficial back line. And if you look at that line, the interconnecting from the Achilles tendon, from BL60 area, right up to the scap. Don't you think it looks like the bladder channel? Yes. Now I can understand why we put needles around BL60 or in tongue system 7701, it can treat the neck because the fascia connects. Right here. Why? I've always wondered why 7701 so far away can treat the neck. So
kindly summarize.
This is a bit on the future of. Yes. Okay. I'm finishing. Thank you so much for staying up with me. And the more I learn, sometimes I feel the more I do not know. So I continue to learn, and I encourage everybody to do so. And don't worry about what system, as long as the system works. I used to think that I used to think that I want to be this master, a dedicated master. But now I think I need to be a mixed martial art fighter. Running a clinic is like street fighting. We need all the skills in order to solve complicated diseases today. So thank you very much for staying with me. I will do my best to answer your questions, and I look forward to seeing everybody in India. All right, I'll be in Mumbai in April, mid-April, Okay then, bye-bye.
Thank you so much, Dr. Vishudhi.lee. I wish we could have some more time to listen you, but unfortunately, this is really an excellent subject which you dealt with us. And a few of our friends, they want to know whether is there any basic book available on tongue. is there a book available, or you prescribe any basic book to be read by, just to have an introduction of this? Yeah.
You go to Google. You go to Google and you Google Master Tung Acupuncture and or
so Google we can find out.
Free download. And you have plenty of books. Actually, the Acupedia, which I'm very proud of that effort to have combined all the books and put it into clinical notes, and this is a summary of, I think, about 40 to 50 books. But if you want to start it, Google is a good place to start, and there are many YouTubes and books on this system.
Thank you so much. Now the people, they must have got the answer. So obviously there are books available on, and in case they are interested, so you have just put some interest, the flame, ignited the flame in those people. Now looking forward to see you in Indore also, Dr. Vishudhi.lee, and we'll definitely like to have some more interactions with you. Thank you so much. Thank you.